Hi, I'm really happy to be here at the Canadian Association of Community Healthcare Centres. This opportunity is really precious to me. I'm a mom of a deceased addict, and I'm here to speak about what needs to be implemented within the community healthcare centres so that people like my daughter get the care that they needed and should have expected to get and didn't. I believe that by raising community awareness, we are going to make the changes that are necessary. And those changes are as complex and as diverse as the person who is in addiction themselves. And that's why I'm here, just to raise the awareness, to get the word out there that we can be doing a lot better than we are.
Bonjour, je m'appelle Esdras Ngenzi, je viens de Calgary, de la clinique francophone de Calgary. J'étais très content de participer à cette conférence, surtout avec la plénière francophone. C'était bien de pouvoir avoir cette occasion de voir tous les autres francophones, partenaires, collègues qui sont en train de travailler sur ce que nous aussi on fait. Et puis c'était bien d'avoir tout le concept de centre de santé parce que je pense que c'est un modèle qui convient pour nos communautés francophones en situation minoritaire parce que ça parle de l'équité, ça parle aussi des barrières linguistiques et autres. Donc je pense parfaitement que c'était une bonne conférence pour l'association et nous avons aussi des outils qu'on est en train d'acquérir qu'on va peut-être aussi mettre en application arriver chez nous. Merci beaucoup.
My name is Mirella Veras. I'm a postdoctoral student at the University of Montreal. I came to this conference because I have a passion for community health and research, and I attended the workshop implementing research in community health centers. It was a very interesting workshop. Actually, from this workshop, I learned three main things. First, the community health center can act as a leadership in the research. They can develop their own research, be the principal, the main investigator of their research. The second model is the active collaborator model, where the community health center can delegate one person from the health center to be a co-investigator in partnership with the university or other institutions. And the third model is the active facilitator. That's the model that many community health centers can start doing research. They can help university students or other agencies to doing research using their facility through recruitment of the members of the communities, etc. Overall, the three models is one opportunity of the community health centers start producing knowledge and translate this knowledge into their practice.
My name is Anne, and I am in from Halifax today at the from the North End Community Health Center. And I went to the data workshop this afternoon and learned a lot. Never thought, 15 years ago you'd tell me that I was interested in data and stats. I would have told you I was crazy, but here I am, and I'm fired up about stats today. I'm going to take it all back to Halifax and try to convince people to join my movement. And hopefully, I learned a lot from the workshop, and I also met a lot of people today that I'll be emailing.
I think the Picard has a wonderful talk, and I totally agree with him because the only way just for the better advocacy is the main aspects of our health promotion or for the healthcare system. So I totally agree with him because with the partnership, with the collaboration with the government and the private sector and other organizations, the healthcare organizations, I think we can make more advocacy, we can strengthen our advocacy part, and that is the only way to bring our voice loudly and convince the government just to change the healthcare system as per the need of the Canadian community. So I think the collaboration and the networking between the different organizations and the community health centers, that is the key message to bring our voice together, just to force the government, and get the political will to change our healthcare system as per the need and the requirements of our Canadian population. Thank you.
Your community health center that are currently not being met through your government funding You can always look for more resources to do the work that you do. Well, that's what we were talking about today at our workshop on the fundamentals of fundraising. We talked for an hour and a half together about building blocks of setting up and establishing a fundraising function in your community health center. This is a great way to support the activities that you do.